for the transplantation of the stem cells. 2 weeks after we do that, you come in, we take your stem cells, and we put those in. At that time, depending on what we're talking about, we may put in exosomes also with the stem cells. They work together, okay? After that, a period of time, you're going to come back and we do a boost. We use a different kind of exosome. It's what we call a chondrocytic as opposed to an anti-inflammatory. And we use PRP again for the follow-up. So now what it's really done for a lot of people is it's gone in from a single injection of stem cells to preconditioning and stimulation, stem cell transplantation with exosomes, and then a boost with exosomes sometime later. We found that that dramatically has the best results of anything. But it all depends on who you are, what condition you have, what we're trying to do. And that's why a consultation is so important with all of your vital information. And again, I know a lot of people, or I've seen seminars where they say, you just come in and we're going to do this and one size fits everybody. And it really doesn't. Everyone's different. Everyone, some people say, well, I'm a quick healer. And other people say, oh, it takes me forever to heal. There's reasons why that happens, okay? And depending on who you are, that's going to, dictate how quickly you respond to these things. Typically not covered by insurance, although some insurances have covered it. I'm going to let Quentin talk about some of this stuff, but what we're finding now, especially post-Obamacare and everything else, is the deductibles are so high, it's usually more than the stem cell therapy anyway. Not to mention what they do cover, they'll pay 80 and you owe 20, depending on what insurance. I mean, it becomes very complicated. But, to have a replacement of something is not inexpensive. And it doesn't mean you're not going to have it replaced in the future and it's going to last forever. And it doesn't mean just because you have the replacement, your pain's going to go away. The knee won't hurt because you have titanium. But all of those prosthetic pieces you put in are sticking into a bone above and a bone below, and you're tying muscle and ligament into this prosthetic. All of those things can be potential problems. So just because you have a replacement doesn't mean you're done. Once you have a replacement, you can't undo it. Once it's gone, and that's what you got. I know you probably all know people who have had it and they said, I wish I never did it because I'm just as bad off or I'm worse off than I was before. Most importantly, again, this is customized to each individual. What we need is with a consultation, your records. Have you had an X-ray or an MRI or a CT? And if you haven't, then we should probably get one to see what the degree is. What are your other comorbid factors? What is your general health? If you smoke, you won't do as well. Smoking affects microvascular circulation with healing and certainly with stem cells. So you won't, we basically I won't do people who smoke. You need to quit smoking if you want to have this done because you're just not going to get the result that you want. So it's really important. Nutrition and all of these other things, your general activity, all of these things affect how you are going to recover because everyone's an individual. And no two people are going to do it the same way. But that's true with everything in our life because everyone has different genetics. It's often good to have, if you come in also, come with, other people because there's a lot we go over. And if you're not, most people don't have a big scientific background. If you don't, there's a lot to go over. There's a lot of science. And when you have other people kind of there, they remember some of it. You can take notes. You can ask questions. But it's important to have, a wife or a spouse or a brother or someone, someone else there to kind of help you out and listen and come up with questions. And again, the conversations are always different because everyone's going to be unique that walks in the door. So that's regenerative therapy. And this is what we're doing, and this is what we're having great results with. Before I conclude, I just want to mention, there is interest from the FDA because they do not want this to be turned into a drug. And what that means is, and these are compliance issues that we have, and if you are going to do this or wherever you go, you want to make sure the number one thing is tissues are minimally manipulated, because if they go outside of that, there's going to be a legal problem. You can't take cells, and some of these places advertise, we'll take the cell and send it to Florida and grow them and get them back. The only way you can send them is if that's an IRB. They're doing research, and that's great. We want the research. You cannot take those cells and give them back to a patient, because once they go into culture, you cannot inject them into a patient, okay? And certainly you can't sell them back. Those are 2 felonies, and there's been a couple places down in Florida and California that are being closed down because this is what they do. If you're going to have this from wherever you're going to have this done, the cells come out, they can't be manipulated. You take them in the hood, you clean them, you inject them back in. You can't plate them. You can't stimulate them with other products. You can't use different enzymes to do different things, because then that's called manipulation. If you manipulate it, the FDA says now it's a drug. And that's a whole nother pathway you got to go down. Not that it still doesn't work, but that's just a regulatory thing you need to be aware of. I appreciate your time. I hope it was helpful. I'm going to turn it back over to Quentin, and he's going to have some logistical information. And I'm going to be in the back, and if people have any questions, a couple reasons I used to open up the questions here. I was told there were potentially HIPAA violations, so I don't ever want to have all of a sudden we're talking about your particular thing, and it's like, we get in trouble. Also, I don't want to take up everyone's time. I know it's a weekend and everyone has something to do. So, specific questions for me, we can talk, but certainly at consultation, the conversation we're going to have is going to be unique to whatever your situation is. Okay? Thank you.
All right, so we covered a lot of information, but I think he explained it in such a way visually and just via spoken word from his background. Each individual person is unique. We all have our own genetic markers, our own makeup. The one thing about Dr. Childers that I really appreciate is his desire to follow the rules, because the FDA, while we may not always agree with their decision making, we have to respect it. And so as the science is advancing itself beyond where we are currently in terms of surgical procedures and so forth, it is important for you to talk with someone. The consultation process, certainly this is not the environment for that, but when you go to the office, he's going to deal with you as an individual. Again, the main reason he asked that you bring someone with you, most of the people that are being treated for some of the ailments that are being seen are anywhere between 35 and 80. And it's a lot to know. But I think understanding the basic mechanics of what the body does and how this science is moving us into the future is the key. And the other side that we have to consider, we are in an opioid addiction crisis in our country. And that is predicated on the fact that we're doing so many surgeries. There's a window of time that you have to take pain meds just to endure that. So this kind of sets the stage to avoid that as much as possible or delay it as long as you can. Your body has secrets that were genetically programmed into you that we are unlocking. So what I would say to you at this point, you'll be talking with some of the young ladies in the back. If you would like to schedule a consultation with Dr. Childers, it's very little. The time he gives you is just your time, and he is setting his schedule and not allowing anyone else in that space. That's your time to consult with him, to tell him about your concerns, to look at your CT scans and the various things. But I think we're at that point now where science is passing the need for surgery because your body knows itself. And the other beautiful thing with regenerative medicine and stem cells is your rejection rate, virtually zero, simply because your cells know who you are, right? So how can you reject yourself? So at this time, we will conclude the seminar, but again, you'll be speaking with the young ladies. If you'd like to schedule a consult, get on the schedule. He's a very good listener, and his background is such that I think you all should be really excited to have someone like him in your town, because people are flying in from California, they're coming from Maryland, they're coming from PA, they're coming from Jersey, New York, and that's only because he's a good doctor. He just knows what he knows. I mean, he's been doing PRP for 15 years. So at this point, it's been a pleasure. We thank you all for coming, and if you'd like to schedule a consult, you'll see the young ladies in the back. Yes, ma'am.
Is there any reason that you can think of, Vance, you've been doing it for 15 years, why insurance won't cover it?
Well, this is the part of bureaucracy that we have no control over. And unfortunately, they would rather spend $40,000 on a surgical procedure, which will require a doctor, a nurse, you're in the operating room, products, anesthesiologists, recovery, physical therapy. There's a whole industry tied to surgical procedures. So the problem is, as we move toward regenerative medicine, we're doing away with industries. And that is not, unfortunately, that's the environment we're in. It's off the record, we seem to be stuck in profit over people.
Yeah, I get it. Thank you.
Yes, ma'am.
Average cost for a knee replacement? Average cost for a knee?
Average cost for a knee replacement surgically, anywhere from $15,000 to $20,000.
For stem cell?
Probably in the neighborhood of 10. It's a big difference, and it's gonna vary based upon what your circumstance is. But I think if you go to your doctor and you ask him, there's a long process there. You're involving at least 15 different people in doing a knee replacement. It's a lot. Somebody's got to pay for it. I was in the hospital for 2 days, and I was on antibiotics and IV. That bill just for those 2 days, $18,500. For 2 days, they did no surgery. They just gave me antibiotics and IV. That to me is ridiculous. How did they get me for $18,500? Because every time a nurse comes in, I have 5 different nurses, so they bill you for that. If a doctor comes in and he's got a protege with him, you get billed for that doctor and the protege. You're getting billed for the bed. I mean, it doesn't stop. If you've ever had a procedure done, sometimes you get bills that you don't even remember seeing that person. I'm still getting bills right now, and I don't ever remember talking to that person.
So this is very, what you said, 10 to 12,000?
It is going to vary based on severity, which it should, because if it's severe, then you're going to need to do more preparatory.
So that would just be for the 3 visits, average for the 3 visits?
No, I don't think we talked about 3 visits. Like, it sounds like to me, you need a consultation. That's what it sounds like, because I can't give you one here. But I think the doctor has to look at, what are you fighting? What are you fighting? What caused the injury? Are you still doing the thing that caused the injury? You've seen another doctor. What did you do already? Where do your CT scans show? What are your MRIs showing? How much improvement have you made? If you've not made any improvement, why? What genetically is keeping your body from doing its job, right? Once those factors are identified, then it is much more easier for the doctor to prescribe what he needs to do. But keep in mind, these deductibles that are now being put into play It also has to do with what's in your diet. Will stem cells help? I'll give you an example. In Japan, people are living 90 years. Well, what's the difference between them and you? The difference is what's in their diet, right? So if you're, as an example, if you're not eating healthy, if you've got a bad routine, if you're not exercising, the body is meant to be in motion. And the reason why it's meant to be in motion is because the circulatory system is to deliver the white blood cells for healing. Need to have a reason to move. When you are stagnant or stationary, you're letting things atrophy. Then they clog up because there's no circulation, which once they clog, what do you do? Pain. So those are always, he's going to look at the whole person, and which he should. Let me make sure I'm not following. Yes, ma'am. Yeah, they'll cover the Oh, that's. I think he's the expert. Yes, ma'am. Yes, ma'am.
And your role in practice, are you part of the practice?
No, actually, I work with stem cell practices all over the world.
And who takes care of them?
Well, the doctors do. Part of my role here is to make sure that they're saying the right thing, that they're not going against what the FDA is allowed, that they are giving the accurate information. I mean, I'm here to observe his presentation.
To be
The doctors do. Yeah, they pay me to come in and make sure that their process and procedures are in line with what is appropriate in the medical
and
community.
you get appropriate information from them.
That information comes from the university, it comes from Boston BioLife.
Okay, that's what I want. Who is Boston Biology?
Boston BioLife is an organization where doctors are trained in regenerative medicine and stem cells. And they use cadavers to show them how to do injection sites. They go over the science. But you can look up Boston BioLife, and you'll see Arnold Kaplan, you'll see some noted people from all over the world. What I will tell you is, in this country, it is my estimation that we're somewhat being delayed in our abilities to, the doctors in America create the science. And then what happens is, because we have certain restrictions, that science gets transferred to the rest of the world. They go over to China and teach it, India, Japan, etc. Well, the rest of the world is spending hundreds of millions of dollars in this. What you just heard, they're spending hundreds of millions of dollars. And the reason is because the cost of surgical procedures, the long-term impact that one procedure has, the drug addiction that comes from that, we've got to get away from that. Because we're in danger right now, in my opinion.
Now, how do we compare to other countries? Like, if you wanted this process down here versus, let's say, you go to Europe, let's
They're
say you go
way
way ahead of us, like, say, in Germany, are they?
absolutely. In Japan, absolutely. China is moving it. They invested $100 million in for regenerative medicine and stem cells. Now, again, it's the doctors in America. Dr. Kaplan was one of them who identified the mesenchymal stem cell and then started really this process of how do we understand what these cells do. Without that doctor, we would be even further behind. And then the other good side is where he's coming from the thoracic side and the cardiology side, they're using stem cells for heart disease. They're using stem cells for people who have strokes. They're using stem cells for all the trials that are being undertaken around the country at universities and hospitals. So we're on the fast track, but I think we're a regulatory environment is keeping us from being. No, ma'am. We're not, well, but see, who owns the FDA?
All the guys that used to work there.
Yes. So,
Now, I have a quick question.
yeah.
The VA is using stem cells.
The VA is looking at stem cells as an alternative to treating traumatic injury. Like when you go to Lake Nona, they have the Veterans Hospital. Lake Nona, yeah, that's one of the places in Florida, but they are. Sometimes the guy has his leg on the table, but he's still getting pain. Stem cells are
So they're not really using the knee replacement and stuff like that.
well, it just depends. Now, the reason it depends is how far along in that process are you bone on bone? If you're bone on bone, stem cells will help, but you've already deteriorated that area where the rejuvenation process occurs. You can get it started again, but in terms of bone on bone, that's a whole nother area. But if you're finding that you're just at the beginning stages or the intermediate stage, it may defer that surgery for 5, 10, and sometimes 15 years. Regenerative medicine reduces the need to have a knee replacement. I have a friend of mine, I won't identify her, but she's barely 50, and they did 2 hip replacements on her. Unacceptable. And each one of, and I even asked her, who about this? Well, my insurance covered the great majority. Well, that's irrelevant. It's your body. You're 50 years old and replacements? Unless you've got a debilitating degenerative disease, that should not happen. Period. And it's unfortunately profits over people. They're working along with the medical universities to use stem cells to help veterans who have traumatic injuries. And they are traumatic. They're also starting to use stem cells for pro athletes who have brain injury. From football, that repetitive brain injury, the science is already there. But when you go to bioinformatics, or you go to Boston Bio, I think your eyes will open up pretty wide, and you'll see that Dr. Childers is right there. He can stand in the midst of some of these top guys comfortably.
Is he gonna be on site? Everything is funny with this, but will he say, no, I really can't?
If he doesn't think he can help you, it doesn't help him to treat you. The problem we have right now is once you say to yourself that you have insurance, that's a golden ticket to run a business.
That's why they take a photograph of that before they use the door.
I'm just telling you, once they know you have insurance, surgery is always the first option. I say, if the actual sailor, he won the Olympic gold medal in 1987 with, if you look at the information